Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres, and if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today's guest is Dr. Elliot Justin, and he is CEO and founder over at FirmTech. Elliot, welcome to the show.
Thank you so much. Good to be here.
All right, Elliot. So big topic today. I want to get into the work that you're doing over at FirmTech and, of course, men's sexual health overall and your focus on this. And I guess just to get us kicked off here, tell us a little bit more about your background. Like, how did you get started both like in the medical field and ultimately as an entrepreneur as well?
Sure. Well, my background, I'm actually an emergency medicine physician and was involved founded several emergency medicine service companies. And that led probably in the late 1990s, to my interest in telehealth, which was really in its infancy then. It's everywhere today. Mm-hmm. My real goal was to provide people with the knowledge.
Did you say in the 90s, by the way? That's a long time ago.
Yes.
I mean for telehealth. Yeah. I don't mean like age. Come on. I don't mean like that. I just mean I'm trying to think about internet when I think about 90s or otherwise. Like it's
we just started with the internet, exactly. And I really was being in emergency medicine, where most of the problems that we see are really actually not emergencies. It really occurred to me that with the use of algorithms, computer algorithms, we really could provide people with the ability to solve problems on their own. And that would allow us to redirect healthcare resources to people that really need healthcare. So, and I'm talking about wrist sprain, ankle sprain, sore throat, upper respiratory infection, urinary tract infection, yeast infection in women. I calculated that, and I had an emergency medicine company that was almost nationwide. No, we're in 11 states, so we were nationwide. Mm-hmm. I calculated that there was like 15, 16 problems that represented 80, 85% of what we saw in the emergency department, and almost all these things could be resolved with an algorithm. And so people would be able to manage the type of problems I just mentioned without seeing a doctor. Just by that time, the computers weren't advanced they are today. It would have required giving people these algorithms and having them work them out on paper and then on a phone call. Now, of course, it could be fully automated. We're still not there yet. We still don't empower people to take care of their health. I then founded a company called SwiftMD that was the second oldest telemedicine company after Teladoc. That was in the early 2000s. Company doesn't exist anymore. It's been sold. And then that got me interested.
Did you have, real quick, before we go further along,
sure.
Did you have any tech background here, or were you just like drawn to the technology portion or internet? Or like how like that's insane. Like you were ahead of your time on this. Huh.
Yeah, and if you're ahead of your time, it's often the risks associated with that as well too. And when we get to FirmTech, we're way ahead of our time. We have world's first technology. So that got me interested in, well, if we really want to take care of people at home and empower them with the knowledge that physicians would apply if they weren't, this is to be candid, if they weren't motivated by secondary gain, by money. Because you in this country, as in most countries, you get the care that the insurance companies or the government will pay for. You can get lots of it because that's how the doctors make money, and you don't get the care that's not covered. So when it comes to healthcare, what do people want most from a doctor? Advice. What if insurance companies or the government pay for giving advice? Nothing. So you essentially really have kind of like a don't care system from managed care and Medicare about what
I get it.
people care about the most. So then I got involved in remote patient management technology because if we want to have people take care of themselves at home, they need to have data. And we live in this really incredible age of healthcare wearables, smartwatches, smart rings. And there's a gap, which is sex. And this is an area of health that is of enormous concern to people. I mean, what do men care more about? How many steps they took yesterday or their erections? The answer is obvious. So, and if you think about the benefits of sex, I mean, if people have sex every day, the cortisol level, which is the stress hormone, is 50% of people who have sex twice a month. Why aren't we recommending people to have more sex? We know from a large study in the United Kingdom that men over the age of 70 who have sex twice a week, as opposed to twice a month, they reduce their cardiovascular risk by 50%. Now, they're going to die anyway, but that's a significant change. And there have been several studies in various countries showing that couples that have sex frequently can cut their divorce rate by up to 50%. Well, single-parent families, divorce rates, these things are problems that have enormous social ramifications, go way beyond health because it has such an impact on kids, too, and kids and crime and so many things. So I left emergency medicine. I was involved in consulting largely in developing these technologies, remote patient device technologies. And about 3 years ago, a urology professor contacted me and said he wanted to come up with a way of counting the number of nocturnal erections that men have once they have them when they're asleep. because they're a leading indicator of men's cardiovascular health. And that took me aback because I had no idea. And we all know about the joke about morning wood.
Yeah.
That's not enough. You see, a healthy man should be having 3 to 5 erections while they're sleeping. And if they're not, in medicine, we say leading indicator, we're saying it's predictive. So high blood pressure, think about that. High blood pressure is associated with heart attack and stroke. Now, high blood pressure, when systolic goes above 180, becomes a leading indicator. But in this country and throughout the world, we treat an association because your blood pressure is high. It's 140 over whatever, 150. That's associated with heart attack, stroke, kidney failure. It's not predictive. But if your nocturnal erections, a man's, go down by 50% from 3 to 5 to 1 to 2 or to 0, it is highly likely that next 2 or 3 years, more than 50% chance that you'll have a heart attack or a stroke or some major cardiovascular complication. So when the urologist told me that, I thought, wow, that's a vital sign. That's will be a vital interest to all men and a more motivating vital sign than calories I eat yesterday or how many steps did I take. So the quality of the sleep. So that's what got me involved in this. And what we've essentially done is create the world's first smart cock ring. So because when this doctor wanted to count nocturnal erections, my thought was, well, why limit it to that? Let's come up with a way of assessing all erections, and let's also at the same time reinvent the erection ring for men. So just to go through those 3 points. 1, overnight, our device, the check ring, measures the firmness and duration of nocturnal erections. So with that data, men can then get an objective sense of where the sexual health is, as well as the cardiovascular health. That's profoundly valuable. And then during sex, we measure, again, duration and firmness. And we also, with that information, men and the healthcare providers can then not only assess their cardiovascular and sexual health, they can measure the impact of medications. And we doctors don't take good care of people's sexual health. I mean, has anyone ever asked you, ever had a doctor ask you about the status of your primary relationship or your marriage or your sexual health? Never. No. And they've never warned you about the sexual side effect of medication. And there are 2 very commonly prescribed classes of medications that I call them, I'm being a little bit vulgar, but I call them the cock killers. So and those are the antihypertensives and also the antidepressants, the SRI antidepressants. And all the men are taking both of those. So with the ring, men can then assess the things that could be hurting their sexual performance and health, medications, diseases, but they also can assess things that might be beneficial, like the PDE5 medications, which are Viagra and Cialis, or testosterone therapy, or shockwave therapy. So where we are, until this device came along, and we've sold about 13,000 products, but until this device came along, if you or I don't know how old you are, I'm 71, but if you or I went to, let's suppose when we exercise, our pulse races, and it's alarming to us. You feel like we're going to faint. Our pulse goes to like 160, 180. And we went off to our internist, our family doctor, and said, gee, you exercise, my pulse races. And the doctor just put his hand on our pulse and our wrist and said, yeah, you're right, Elliot, your pulse is racing. Take this digoxin pill and come back in 3 months. We would think, WTF, what's this, 1900, 1850? How about an electrocardiogram? How about a Holter monitor? How about blood tests? How about the angiogram? But when it comes to sexual health, a man goes to a urologist and says, I like my sexual health where it is right now. Everything's good. But I want to keep it. Or if I'm getting a problem, that's all. That's the equivalent of they just put a finger on it. They don't do anything. They just prescribe Viagra or Cialis to you until you come back in 3 months. Well, so with data, with a wearable, people can now get data-driven, objective, actionable, personal healthcare. And I say personal because we're all different. Because if you don't mind me going on about, because I'm so frustrated with the medical profession I've been in forever. We treat everyone as if they're one size fits all. I don't know how old you are. I don't know your weight. Let's suppose, I'm assuming you're not a different age, might be different weight, might be different medications that we're taking. And if we went to a doctor with high blood pressure, they would put us on the same pill to start. Well, that's wrong, because with a blood pressure cuff, which is, I don't know, like 60, 70 million people have blood pressure cuffs in the United States, you can actually titrate your dose yourself. I'll pick up myself for a moment, and I'll get back to sexual health in just a second. But when I started thinking about developing a device to track sexual health, I thought, gee, I have high blood pressure. I take medication called losartan for it. Do I really need it? So I got a blood pressure cuff. I should have got one years ago. And I started taking my blood pressure once or twice a day and realized I only need the pill 2 or 3 times a week. Otherwise, my blood pressure is normal. Why would I take the pill?
Yeah.
And people, so, off the subject of sex, if your listeners got have high blood pressure, get a cuff. See what's really going on, because everyone's unique. So getting back to ED, this is erectile dysfunction. This is an enormous problem. And 50% of men by age 50 report 4 or more episodes of erectile dysfunction. At age 30, it's probably 25%, and it goes up 10% per decade every year, 60, 70, 70%. So, and most people want to enjoy the pleasure, the emotional, the physical and emotional benefits of a happy sex life. So with data, you can start to address problems and relieve anxiety.
Talk a little bit more about how the data, like over time, like if you can give kind of like a use case,
Sure.
whether it's fictitious or otherwise, but in general, like how you would use that data over time. Because I'm trying to make the connection for myself and also the listeners. So I think about, and I think the Fitbit or like the Apple Watch or whatever, like that's a good kind of like comparison.
Yeah, that's a good analogy.
Okay, you look at that data, maybe weight, maybe sleep or things like that, but this takes it to the next level, and this is a different way of doing that. So maybe talk about how that data, so now how is data, how can you use it?
Yeah, sure. A lot of people call what we're doing a dick bit, just to play off of the app bit.
Yeah, I get it.
So we've had 2 men that I'm aware of, and we've documented close to 50,000 erections. We've had 2 men get cardiac catheterizations. One guy, his strong family history of cardiovascular disease, and he went from 5 nocturnal erections to 2 nocturnal erections. Now, he was having other associated symptoms.
Yeah.
He was feeling a little short of breath, exercise tolerance was less. But the device was telling him objectively that something is wrong. I'm not going to tell you we saved his life, but he got a cardiac catheterization before he got a heart attack, and that's great. So, and we've had 2 men I know get cardiac catheterizations. We've had, I'm aware of, 2, we've had a couple of divorces too. We had a guy who claimed he couldn't get up with his wife and was blaming her. And his wife bought him a tech ring. He didn't want to wear it. She seduced him into wearing it with sex. and he
Good way to do it. Yeah, there you go.
Yeah.
Go ahead.
So it turned out that he had nocturnal erections. And the issue was really, if a man is having nocturnal erections but can't get up with a partner, there's something going on in the relationship. And at the opposite extreme, we had another couple where the guy was also angrily blaming his wife for his lack of sexual performance, and she was concerned about his health. He was overweight, diabetic. He had risk factors for ED as well as bad cardiovascular health. And he got a ring, and he had only 1 week nocturnal erection as opposed to 3 to 5 strong ones. He has, the guy had significant cardiovascular disease. And she divorced him because she was pissed off at him for the way he was treating her. But and he ended up he's the other guy who ended up getting cardiac catheterization. So the ring also kind of made it clear to him that the issue wasn't her. He had a major physical problem. Not a mental problem. He has physical problems. He might have mental problems too, but in this case, in this case, he had physical problems. So we have men that are using the device. They're considering therapies for shockwave, so therapies for ED, like shockwave therapy. Well, if a man, and it's expensive, it's $6,000 to $12,000 a year. So if a man has nocturnal erections, he will benefit from the shockwave therapy. But if a man has no nocturnal erections, he's not going to benefit, and he's wasting his money. We have men who are using the device, and doctors who are using the device after prostate surgery to monitor recovery. The therapy is difficult. Men have to do exercises, take medications, and stick with the program in order to increase their chance, because the incidence of impotence after prostate surgery is up to 70%, as low as 35 to 40%. But it's contingent upon, to some degree, upon men complying. But if nothing's happening, the men often just give up after months. But if they see that they're having nocturnal erections and there's some recovery going on that they're not aware of, that can inspire them to stick with their therapy. So
that makes a lot of sense too, though, because it's just another one when we think about, and I know you talked about the different types of rings and wearables and things like that, but this makes a lot of sense for it to be another indicator, and especially if that is how, especially with ED or something like that, to where if that's how your body is telling you something's up, like and you want to start, like, everybody's body's going to start showing a symptom in a different way, whether it's weight or otherwise, right? Like whatever it is. If that's how your body is kind of like letting, hey, you're not functioning, like the system isn't working, whether it's your sexual system or otherwise, like, then this is a way to start exploring that and to start thinking about like how you go down that line and to start collecting data. Like, I think that's super interesting to think about.
You can't like, really. I mean, the biohackers like to say you got to track it to hack it. Well, you can't track it unless you have data, and now you can. Now men can have data. So previously, the only data that was available in this area was going into a urologist's office, maybe getting an ultrasound, a Doppler study, but that's not replicating what's going on at home in real life circumstances. And
for sure.
And
also not like over time. Not like over time.
Right, exactly. And not like over time. Yeah,
you're a warning indicator. Like, I know you don't, I don't think you use the word predictive, but it has a level of
it is predictive.
It is. Okay. Got
correct.
it.
That's what I mean by leading indicators, predictive.
Yep.
And you're making a really good point. It really is over time, because actually quite a bit of variability. I mean, if other men are using it to titrate, to figure out what's the right dosage of PDE5 medication. So the male mindset, actually most people's mindset is, hey, if the doctor recommends 5 milligrams of Cialis, I'll take 20. If the max is 20, I'll take 40. Well, you can actually see with this technology, well, does it really have more impact? I'll speak for myself because I take 5 milligrams of tadalafil every day, and 71 years old. But I don't, if I go to 10 or 20, if I get to 20, I just get a headache. If I go to 10, it doesn't have any impact. There's no difference. We have men who are utilizing the device to see the impact of testosterone therapy. Testosterone therapy is expensive. It's expensive. Is it working? Is it not working? And most importantly, what's the right dose for me? My doctor might say, I start everyone on this dose. Yeah, but now with data, getting back to the blood pressure analogy, you can actually, you're unique. And what you might respond to might be different what I respond to.
Yeah, this makes total sense. It makes total sense. And another data point, another type of wearable someone can use. I'm just overall excited about what's going on in medicine when we think about wearables and other things, like the potential to extend not just our longevity of life, but like quality of living, right? This is also, we've been talking a lot about the medical side, but then just the quality side of having a healthy sex life and having a healthy, maybe not, and I'm not saying these particular examples you've given, but in general, maybe this does help some relationships, revitalize them, and lead to some, let me be optimistic and say, some less divorce or things like this, or communication or whatever that is that it leads to.
I know it does.
It's all in the mix. I feel like it's all in the mix.
I mean, I was not, when I started the company, I wasn't thinking about how beneficial it would be. And I get really heartwarming emails 3 or 4 times a week from people who tell me that we've changed it, we saved their marriage, or we saved their relationship, or they didn't. Because there's another component to what we're doing, which is just the benefit of an erection ring. So in my lifetime, I'm going to call them cock rings. That's what they're called commonly. I try to call them erection rings. The medical field calls them constriction rings. Sounds like something a Nazi would think of. Who wants to put a constriction ring on their penis? So let's call them cock rings. They're made out. They've been for the last 150 years. They've made out of hard silicone. They pinch. They're uncomfortable. They choke off the arterial blood flow, and they've never really caught on. So unlike vibrators for women. So in order to count the number of nocturnal erections, we need to come up with a cock ring material that would be comfortable and will also allow arterial blood flow in, so it could be worn for hours and not prevent erections. Our rings are made out of an elastomer, which is a softer material, and whereas silicone, the conventional sex toy material, makes you adapt to it. Elastomers adapt to you. It's great. It's a great material. And what men don't realize is, because whether it's from pride or because these conventional rings have been poorly designed, is that a well-designed, physiologically considered, if you will, erection ring will enhance a man's pleasure. It's not a crutch. Guys can kind of see these things as crutches, and they're reluctant to use them. It's an enhancer. And if a man, because he's using a ring, is more confident and is going to last longer and have more intense orgasm, it's good for his partner as well too. In younger men, performance anxiety is probably the leading cause of And a ring can make a man more confident, because most men's problem is not that they can't attain erection. If a man can't attain erection, he's got a major problem. He needs to see a urologist. If a man can't sustain an erection, which is you get an erection and you lose it, there's usually an anxiety component to that. So you're getting blood in and the blood's not staying there. Now that could be due to psychological factors, anxiety. It could be due to a partner. It could be due to distraction, or it can be aggravated by medications. I talked about the cock-killing medications before, antidepressants, antihypertensives, diseases. Well, so a well-designed ring helps all men without ED, just performance anxiety, or men who would not even just want to enhance their performance, or men who have ED that's due to a physical issue. So if I were to want to send a message to your listeners, it would be threefold. One, put a ring on it, especially if you're a man over the age of 45, 50, or you're a man who's diabetic or hypertensive or taking medication that could affect sexual performance. Put a ring on it. Get the data and figure out what's going on objectively. Don't rely upon speculations, anecdotes, what you hear from friends. You now can figure out with objective personal data. Two, if you want to last longer and have more intense pleasure, put a ring on it. And three, do it for your partner. Because a good sexual relationship is one of the byproduct of a successful partnership with someone, man or male or female.
It's awesome. Elliot, this has been a lot of fun. I mean, I learned a lot. I'm sure my audience did as well. It's a great story to bring to my audience. How do people get a ring? Like, tell me more about like the website or how people can connect.
Yeah, you can find us at myfirmtech, myfirmtch.com. You can reach me personally at Elliot, ELLIOT, at myfirmtech.com. And the next 30 days, you can use the promo code I know Elliot, IKNOWELLIOT, and get a 20% discount.
Awesome. And for everybody listening, just so you know, we'll put the links in the show notes to the website. So again, that's myfirmtech.com. And speaking of the audience, if this is your first time on Mission Matters or listening to Mission Matters, we're all about bringing on business owners, entrepreneurs, and executives and having them share their mission, the reason behind their mission, their companies, how they're out there helping people. If that sounds interesting or fun or exciting to you, we welcome you. Hit that subscribe or follow button, number one, but also look out on your phone after you hit that subscribe button, because tomorrow, guess what? You're going to get a notification. That notification is going to be for our next episode. So we'd love for you to come back and listen to some more episodes and some other amazing entrepreneurs just like Elliot. And Elliot, again, thank you so much for taking some time out today to come on the show.
Thank you. That was a lot of fun, and I really appreciate the opportunity.